when I explain to families what dementia is. It's all about empathy. It's not about what is the diagnosis. No, but it's all about what is happening in the life of this person. What is this person experiencing? What does it mean to that person going through cognitive impairment for the families?
Welcome to Brain Bridges, the podcast where we hear from leaders working to advance equity in brain health and explore the journeys that shape their work. I'm your host, Victor Valcour. Each guest in our series is an Atlantic Fellow for Equity in Brain Health, a global fellowship bringing together leaders across health, science, advocacy, and the arts to improve brain health and reduce inequities around the world. Today we hear from Mawuli Lawson, a clinical neuropsychologist in Togo, working to expand access to brain health and cognitive care in his community. In our conversation, Mawuli reflects on building brain health programs from the ground up, the importance of community trust, and what leadership looks like in places too often overlooked in global health. Let's begin. I wanted to start by asking you what first sparked your interest in brain health.
Yeah, thank you for having me. My name is Mawuli Lawson, and I'm from Togo. Togo is a very small, tiny country in West Africa with a population of about 9 million people. And I was raised in the central northern part of the city. Then I moved to university. So I decided to do clinical psychology because I was interested in mental health, but also human behavior. But my real encounter and interest with brain health developed when I was doing my clinical rotations at the public teaching hospital of Lomé. We were seeing people who had, let's say, road accidents and they end up having traumatic brain injuries. And also people were having strokes. I was so impacted how those things were actually destroying their life and their ability to go back to work and all those things. So at that moment, I got really interested in the brain, how the brain functions and its relationship with behaviors and all those things. We were working with those people because they were having actually memory issues after TBI, for instance. But with time, I noticed something. We were also receiving, because people knew that I was offering cognitive rehabilitation to people for memory issues. I was also receiving referrals from colleagues at that moment with people who have memory issues, attention issues, executive function impairment, but with no history of TBI and no history of stroke. So that was quite new to me. And I was not trained to handle anything that has to do with dementia or Alzheimer's disease. So I decided to learn to teach myself, actually to read about it, read, review articles and other things in order to get a better knowledge about it and to help out families, to explain to them and help out patients. So I discovered neuropsychology. And from that moment, I knew that I really want to do a PhD in neuropsychology.
It's very interesting to me because many times people choose a career based on a mentor or a role model.
Yeah.
And it struck me that you decided to become a neuropsychologist and you'd never met one.
Yeah, that is true. And that is one of the most unusual aspects of my journey. At that time, there was not a single neuropsychologist in Togo. I've never met actually before traveling to France. What is amazing is that when now I'm back to Togo, I'm in Togo, and I'm teaching neuropsychology at the university where I studied actually. And my students, they have a different story because at that time, I did not have a role model, a local person working in the field. I did not have, but today they have someone actually from Togo working in that field. I think that is something that is amazing.
When you got back to Togo, you had the training and then you didn't have the tools. Tell me a little bit about having no neuropsychological tests, let's say, but resources in general.
Even before my PhD, even in Togo, we were always having that difficult topic because we study assessment tools actually, yet we cannot make use of them because none of them, they were not validated, they were not culturally adapted to the context here in Togo. So they were quite useless actually. So after my PhD, that was the same situation. But I knew then that if I want to do a career in clinical neuropsychology, I had a huge task ahead of me, which is to involve myself, to commit myself in culturally adapting tools, validating tools. In our context, actually, the healthcare system was not designed for dementia care, for instance, or for neuropsychology. Those things are quite new, and the healthcare system is more focused on basic needs. And there is a few room left for actually anything has to do with cognitive impairment, dementia, Alzheimer disease. And we understand that one with little funding, or let's say no funding actually at all provided to that one. But the challenge is all about a great need on the field, but low resources actually to do the work. And it has not always been easy. We are trying to make things happen, but for now, it's very slow. And to make things happen, it's a lot of bureaucracy. And if you are not patient, you will not make it happen.
You've worked with the community a lot. Tell me a bit about how you build trust and work with communities.
With my team. With my team, actually. Without my team, that is not possible. When things are new to my people here in my country, it's a bit difficult to make them buy that one. You need to look for strategies to make it happen. So my team, they have been tremendous, helping me to shape the strategies to reach communities. And we have done amazing things together. And for us, trust, building trust, I would say that is all about showing up consistently, being there with people, answering their questions, actually. And it's not about having one event and you forget about it, doing it consistently over and over again. So we have done many outreach activities and we have done many brain awareness activities. The way we started is just about going to the community, finding key persons from that community, inviting them to our team. They join us. We explain what we want to do with the community. Sometimes, many times, we give them our T-shirts. They wear our T-shirt. They know the message, so we go together with them. So when we go together with them, we are welcome actually because they see one of them, and we are really welcome among them. And every time we work with a community, we make sure to have what we call brain champions. We call it Ahonhon champions. Ahonhon, I should tell you, is brain in our local language. So there are voices to amplify our messages. With that one, and being consistent in doing activity, event, and engaging them, and being there to listen to them, I think has been the key to get their trust. I have a small story. We were planning a brain awareness week activity, and we needed for that one a permission from the Ministry of Health because every time we go to the community to engage, to talk to them, we need to get a permission. And when I went to the office to get that permission, the person just told me, no, it's confusing. We don't know you guys, what you are talking about. Is it even important? And all those things. And that day I went back home without the permission. So the following day, I went back again and I found another person in that same office. And the person welcomed me and I was talking to the person. He was busy doing something on his laptop. And I say, okay, we are doing brain health. And say, what is it about? I say, we talk about how brain health is important for people. We'll be talking about dementia also and Alzheimer. And when I say Alzheimer, that he stopped typing. He looked at me and say, what did you say? I say we'll be talking about brain health, dementia, Alzheimer's. He said, yeah, Alzheimer, do you know what is it? What do you know about it? So he told me, just sit down. So I sat and we had 1 hour discussion because he was having one member of his family dealing with Alzheimer's disease. So he had many questions. So I explained, I explained. By the end of the day, he got me the permission quickly, and himself, he attended our stand. He came to our stand that very day. Actually, sometimes you can be lucky with people and that make the work easy, but other times it's quite complicated. But my team had been incredible to find ways to actually make it happen.
It sounds like the concept of brain health is not universally understood. How have you tackled that?
Yeah, that's a great question. People know about mental health, yeah, because many things have been done by the WHO on mental health. But when you're talking about brain health, they are confused. They ask you, is it different and all those things? And I do understand them. So what we have done here in Togo is that we stopped talking about brain health in French, la santé du cerveau, and we take the word brain in the local language, which is ahonhon. So we have the term ahonhon. They know what is it. So when we go to them, we talked about ahonhon first because we don't speak foreign language. They better understand. So even the whole project is called Ahonhon Project. The book we have published is Ahonhon book. So we focus everything on the term, what they understand from the context, and they have been more open when you talked about that one and you explain it from there.
Do you think you're a leader?
Oh, yes, I am a leader. Yeah, for sure. And personally, I picture leadership like a ship which carries leaders forward. I see myself like that ship or building that ship. And I know for sure that at least my students are on board. I'm not alone in that ship because there is a saying here in my place. They say, if you think you are a leader and you are walking alone, no one is following you, you are just taking a walk. So I know that I'm not taking a walk and people are following me, my students especially, they are amazing.
What do you think it takes to be a leader that others don't see?
A lot of things, but I will say that it's all about a great deal of sacrifice. When we do for instance, the brain awareness campaign and all those things, people see that, they say, oh, he's great, he's amazing, but they don't know about the time you dedicated for that one, the energy, even the personal money you put in those kind of things. Yeah, that is quite demanding. And on the other hand, I will say that, okay, leadership also meant for me being able to grab a seat and make my country, Togo, sit at the table of brain health conversation in Africa and around the world. And it's something people don't see, but it's not easy to grab a chair and to sit at the table because it's not a gift. People don't give it to you. You need to grab it with work, with commitment. You have to show proof that you can sit at that table, and that sometimes is demanding. People don't see all those things going on. In my context, you should have patience as a virtue. If you lack patience, you will not make it happen. I would say that I have patience whenever I initiate things. I say to myself, yes, for this time it will not work. Perhaps it will not work, but let's be patient and just try to work and it will happen one day. That has been the case for all we have tried, and that failed, and try again, failed, and I say to myself, be patient, and that will happen one of those days. And also, what I used to do is that I keep talking about what I do in very simple ways to people, especially those who decide, those who are shaping policies in my country, those who are supposed to make things happen. I try to engage with them to explain in a very simple way how brain health is important and has to be put in the bigger picture of health. And it might take time, but I'm sure it will happen and already is happening. But just that is slow and just need patience to make it happen.
We really lean heavily on our values: authenticity, fairness, openness, respect, courage, and empathy. Do any of those values particularly resonate with you as a leader?
Empathy. Empathy. Empathy has shaped my work. When I design a program, when I design a campaign, a book, and whatever activities is with a lot of empathy. When I explain to families what dementia is, actually is all about with empathy. And even when I train students, when I teach at the university with students, it's all about empathy. It's not about what is the diagnosis. No, but it's all about what is happening in the life of this person. What is this person experiencing? What does it mean to that person going through cognitive impairment for the families and other things? So the focus has always been empathy, and that is only things that makes me move on and be strong and focused and grounded.
Is there one action people listening today could take to support equity in brain health?
I think for me, the most important one is to amplify voices from low and middle income countries, especially voices from small countries. We know that we have the big group of low middle income countries, but within that group, we have small countries sometimes. And what is going on in those countries, they are the same. It's not about the population of those countries, it's not about the size of the population, but it's all about something going on and brain health not being implemented, dementia, Alzheimer's being there. That is what it's all about. So please support and amplify the voices of people from low and middle income countries. We like to welcome people visiting us, and people are quite simple actually. And the economic situation is not that good, but people still have a joyful life. And when you see people on the street, some people are joyful, are happy with their life, even though they don't have much on their own. And Togolese people are very simple people, very simple and very peaceful people. I always have Frédéric Chopin in my heart because he taught me a lot of things through his music, actually. And he used to say that the highest perfection is simplicity. And I do believe that one. And I try to implement that one in my work every day.
That was Mawuli Lawson, a clinical neuropsychologist in Togo, whose work focuses on expanding access to brain health, cognitive care, and dementia prevention in his community. If you enjoyed this episode, please share it with a colleague, friend, or student interested in brain health and equity. Brain Bridges is a production of the Atlantic Fellows for Equity in Brain Health at the Global Brain Health Institute, University of California, San Francisco. Production support is provided by Podfly. Podcast artwork by Atlantic Fellow Kagundu Rodney, with design by Carolyn Prelo. I'm Victor Valcour. Thanks for listening.